Magandang gabi mga kaibigan. Welcome po dito sa
Medyo
Radyo
choppy
Klinika.
rin yung
Oo,
tunog, ah.
oo nga. At ngayong gabi po ay kasama natin, wala pong iba kundi ang isa pong eksperto sa traditional Chinese medicine pero isa rin po siyang Western medicine practitioner. Wala pong iba kundi si Dr. Philip Tan Gatue. Hi Doc, magandang gabi sa iyo.
Mhm. Magandang gabi po sa
Thank you Doc na
magandang
kasama ka
gabi rin.
namin.
Salamat
Oo.
po sa muling pag-imbita. Alam mo naman, always a pleasure to educate.
Oo, kahit na pagod na si Doc kasama
Always a
natin.
pleasure to educate and teach.
Thank you, Doc. Ngayong gabi ang pag-usapan natin yung tungkol
Ayun.
sa mga Chinese traditional medicines and how it can help people, lalo na ngayon na syempre may COVID-19 pa rin, ano? Paano ba makakatulong ang Chinese traditional medicine? Pag
Opo.
sinabing TCM, ano ba ang traditional Chinese medicine, Doc? Anong nagko-comprise dyan?
Well, traditional Chinese medicine,
Mm-mm.
um, traditional Chinese medicine, ang definition niyan sa National Institutes of Health ng
Mm-mm.
Estados Unidos ay complete medical system based
Mm-mm.
on the traditional beliefs,
Mm-mm.
theories of people of Chinese culture. So,
Mm-mm.
it's considered traditional in areas na maraming Chinese population such as
Mm-mm.
Taiwan, Hong Kong, People's Republic of China, and other countries such as that. So,
Mm-mm.
meron ang importante doon, hindi lang siya yung modalities, hindi lang siya yung acupuncture, hindi lang siya yung herbs, pero siya yung sistema. So,
Mm-mm.
kasi for example, acupuncture, pwede ka naman tumusok na binabaliwala mo yung traditional Chinese medical theory.
Mm-mm.
Or pwede kang tumusok na namimili ka ng points based on yung theory.
Mm-mm.
So, it's a complete medical system. It's not just ito yung herbs na galing
Mm-mm.
China or ito yung acupuncture na Chinese points. Hindi lang siya ganun.
Mm. Okay. At sino ang puwede lang mag-practice nitong traditional Chinese medicine? Meron bang parang expertise kayo dapat diyan o license before you can prescribe traditional Chinese medicine and apply itong TCM? Yes, Doc.
Depende rin po yan sa kanya-kanyang bansa. For
Mm-mm.
example, in Japan, acupuncture may be practiced by a non-MD, basta may
Mm-mm.
training. Pero yung mga herbal formulas na based din sa Chinese medicine, in
Mm-mm.
Japan, kailangan doktor ang magpa-prescribe na trained in the herbs. In other
Mm-mm.
countries naman, there are, for example, in the United States, they
Mm-mm.
have one licensure exam. You're called a licensed acupuncturist, pero that's more or less
Mm-mm.
all of Chinese medicine. In fact, depending sa anong state, iba-iba rin ang title mo. Kung
Mm-mm.
taga Florida ka, ang title mo is Doctor of Chinese Medicine. Sa
Mm-mm.
ibang states, you can't use the term doctor. So
Mm-mm.
marami-raming variations. In People's Republic of China, doktor ka talaga.
Mm-mm.
Aaral ka, may licensure exam, ka-level mo ang Western medicine. In Australia, pwede ka mag-acupuncture lang, mag-herbs
Mm-mm.
lang, tapos pag combined, yun ang tawag sa'yo, traditional Chinese medicine doctor. Dito sa
Mm-mm.
Pilipinas, wala pa tayong licensure,
Mm-mm.
but we have acupuncture and as one field, and then we have traditional Chinese medicine referring to herbs as an
Mm-mm.
upcoming field. But the
Oh.
most we do sa Pilipinas ngayon is certify. We don't certification is different from licensure. Ang ibig lang
Mm-mm.
sabihin ng certification, o sige, pinag-aralan namin yung credentials mo, okay
Mm-mm.
ka. Ang licensure,
Mm-mm.
they grant you the license to practice and regulate the practice. Pwede ka nila tanggalan ng lisensya.
Okay, oo. Dito sa atin, certification lang, tama ba,
So,
Doc?
marami rin
Oo.
siya
Mm-mm.
variation.
Oo. Okay.
Sa
Pero,
Pilipinas,
yes.
we don't actually have any particular,
Oo.
how do I say it?
Mm-mm.
Wala pa tayong regulation. Hindi siya parang doktor or nurse na talagang may na.
Mm-mm. Okay. Kasi, di ba, meron naman tayong PTAC na tinatawag. Hindi ba sila ang nagre-regulate sa mga nagpa-practice ng traditional Chinese medicine dito? sa Pilipinas?
They don't regulate. They can, kasi when you say regulate, that's a very strict term. The
Mm-mm.
PRC, Professional Regulation Commission,
Yes.
has the authority to put you to jail if you practice medicine without a license.
Mm-mm.
Ang PITAC, we are trying to get increased regulatory powers. Pero kasi, as government-owned and controlled corporation, kulang pa yung, wala pa siya masyadong regulatory powers. It's more
Mm-mm.
of, yun nga, certification, supervisory.
Mm-mm.
So they can, it doesn't have the police power yet. But subsequent legislation
Mm-mm.
might change that.
Oo. Pero 'di ba dapat talaga i-regulate din 'yan kasi ang traditional Chinese medicine di rin naman basta parang ibinibigay lang yan randomly, 'di ba? Sa mga taong may sakit, hindi parang kasi dahil iniisip na iba, natural naman, sige. Hindi naman siguro tayo
Eh, kung ako
ma-overdose diyan. Oo. Yes, doc.
kung ganun lang, ito lang masasabi ko.
Mm.
Anybody who says na there's no side effects,
Mm.
anybody who says na 100% cure rate, anybody who says na di bale walang overdose, and you can quote me on this, is
Mm.
either lying or is an idiot.
Mm.
You can quote me on that. Anyone who says that is lying or either nagsisinungaling siya para makabenta siya ng produkto o tanga siya.
Mm.
Why? Because common sense yan. Anything, maski tubig, sobrang inom mo, mamamatay ka eh.
Oo. Oo.
Yun pang gamot or herbs na nakapagbibigay na nagbibigay lunas sa sakit.
Mm.
Kung ganun ang power niyan, paano ba kaya pag sobra-sobra yung dose? Siyempre nakakasama.
Mm. Mm.
Common sense lang po, di ba? Pero it's unfortunate some people who are quacks, they don't care about common sense. They care about selling you a product.
Mm. Mm.
So, ako, it's been a long time advocacy of mine that there should be a separate law governing Chinese medicine
True.
as a PRC regulated profession, and there should be a separate classification sa FDA for Chinese medicine. Why? To
Mm.
protect
Mm.
the
To protect the consumers,
consumer.
to protect the consumers, right? Oo.
For example, yung lianhua lang ang regulate. If you make a blanket law, batas na Chinese medicine, automatic, lahat ng Chinese medicine covered.
Oo.
Hindi mo na kailangan isa-isahin. So yung mga nagbebenta ng peke na Chinese medicine, pwede natin agad sugurin.
Mm.
We have standards na.
Oo.
This is my suggestion.
Oo.
I could be wrong.
Which is good. Oo. Lalo na ngayon, Doc, na talagang sumisikat na ngayon ang
Pero
lalo
just to give you an
yes.
idea
Mm.
about, I was about to say, pasensya na po, natalumpati tuloy ako, nangangampanya ako.
Ah.
If you just look at any book of traditional Chinese medicine herbs, almost every single herb, maximum dose, side effects, how to relieve the side effects. So it's really very complicated. Kanina, I was just lecturing to some dermatologists, around 60 of them. I showed them, that's why you never give this herb mag-isa. Palaging kasama tong isang herb. Why? Kasi kung mag-isa, baka may masamang side effect. Pero pag pinagsama mo, they cancel each other's side effects. So that's good.
So hindi rin pala pwedeng basta bigay ng bigay dahil natural. Kailangan
Mukhang may
talaga.
lag yata. No?
Oo, may pag-aaral. Pero, Doc, naintindihan naman kita. At saka ito nga, lalo na ngayon, mas importante na we are observing yung talagang strict na protocols or regulations regarding the use of traditional Chinese medicine dahil ini-introduce na ito for COVID-19, hindi ba, Doc? So what can you say about
Yes,
that?
one herbal formula for possible use in some cases of COVID-19. So that's why we need to have a blanket regulation for Chinese medicine. Otherwise, isa-isahin natin yun. We're talking about hundreds of formulas. In Japan, just to compare, in 1967, Japan already took 4 Chinese herbal formulas, 4. kita ba sa camera? Oh,
Oh,
or
yes, yes.
covered by their national healthcare system and prescribed by doctors. So that's 1967. Now we have more than 100. But you only doctors can prescribe that. See? So that's the
Sa
actually the
Japan.
model na binabala ko sana sa Pilipinas. Pwede natin
Yes.
gayahin sa Japan in the sense na we have a list of formulas na pwedeng ibenta. We have a list of manufacturing standards. So hindi basta-basta everything is preset. So pagbili mo sa butika, yun na yun. And prescribed only by trained professionals. In
Oo,
Japan,
oo.
MD.
So,
Kasi
paano yan,
ang
Doc? Ang ibig sabihin nan kailangan may special
well,
training din dito sa atin sa Pilipinas before they can make
ako
prescriptions
ngayon,
regarding
may
TCM. Oo.
training na
Oo. Pero ngayon,
ako ngayon.
yes.
I trained in China years ago. I'm still going through more training now. I'm working on an advanced degree. So habang nagpa-practice, nagtuturo, nag-aaral pa ako.
Paano ba itong
Because
training na
you
ito?
never
Oo.
stop.
Oo. Dito ba sa Pilipinas walang ganyang
Well,
training?
first,
Oo.
we have, but it's not yet considered by CHED to be a master's degree. The goal is master's degree siya tulad nung sa States. Kasi in China, you can become a TCM doctor straight out of high school. Ganon din sila sa Western medicine. Wala silang pre-med.
Oh, okay.
Out of high school, Western medical school or Chinese medical school. Or meron na silang combined 7-year program out of high school na Western and Chinese medicine combined. Dito kasi sa Pilipinas, ang model natin is the American model where usually may pre-med and then we go to med school. Sila wala.
Oo.
So, bachelor's degree. And then,
Oo.
but in the States, they don't have bachelor's degree for Chinese medicine. They have master's degrees.
Okay. Baka dapat
So
gano'n na
we're
rin sa
trying
atin,
to
kung
have that model
oo.
of master's degrees.
Kung may gusto talaga na doon din mag-focus, no, sa traditional
Well,
Chinese medicine. Dapat merong ganyang program dito sa atin.
for example, I told you po, sorry.
Yes, Doc. Oo. Go ahead, Doc.
We have one. It's just not yet approved by CHED. I just want to give an example of how complicated Chinese medicine is. Nag-lecture ako sa mga dermatologists kanina. Just to give an example, makating balat, itchy skin. Nakatatlong slides na ako. Is it itchy skin because of wind heat, wind cold, wind damp, wind dry? So bawat isa niyan, ibang treatment. That's for acute.
Oo.
Paano ba pag chronic? Is it blood deficiency? Is it liver wind steering? Is it this or that? How do you know? You have to know how to get the history. You have to know how to feel the pulse. You have to know how to look at the tongue. So, hindi siya basta-bastang, makatay yung,
Pahid.
balat mo. Ito, inumin mo.
Oo,
No.
kaya pahid.
You have to get a complete history. You have to examine the patient and come up with a treatment plan.
Oo.
So, you don't learn that in like 10-day seminars because there are quacks out there teaching herbal medicine 10-day seminars lang.
Parang ang nakukuha ko dyan, Doc, ang tinitingnan sa traditional Chinese medicine, yung source nung sakit. Hindi yung parang tinitingnan mo lang yung mismo sakit at yun ang gagamutin mo. Kundi hinahanap nyo talaga, ano ba pinanggagalingan nitong karamdaman
Not just
ito?
the-
Oo. Yes, Doc?
The ang nangyayari sa atin ngayon is medyo may lag tayo.
Oo,
So I think
oo.
there's a few second lag. So to the audience, it might seem awkward. We'll just let them know na naglalag konti.
Yes. Oo.
So, diba? Parang ganyan.
Oo. Pero
So
anyway.
just, yeah. So, for example, in Chinese medicine,
Oo.
we look something as simple as ubo.
Okay.
Is it nasa loob yung ubo? Nasa labas yung ubo? Is it because something is excessive, something is kulang? Ito ba ubo, gawa ng init, gawa ng lamig? Because in Western medicine, we're used to thinking, or even in traditional Philippine medicine, kahit anong ubo, lagundi. In Chinese medicine, it doesn't work that way. It's much more complicated, but that is why there's lesser side effects. You really have to think of parang pagluluto.
Oo.
Ah, ang ibang tao mahilig sa maalat, yung iba hindi, gusto maanghang. Titimplahin mo yung recipe, customizing it for the particular uh, person you're cooking for. Merong ibang tao gusto nila fried rice,
Yeah.
mamantika. Meron, di ba? Okay na sa kanila, dry ng konti. Depending dun sa pangangailangan ng tao, you have to customize it. That's the best way I can describe it. So, merong mga, for example, lianhua, it's more of a one size fits all. Which can work. Because let's say 9 out of 10 people, ganun ang pakiramdam, pwedeng gumana tong formula, pwede siya. Pero there are some special occasions, hindi ka basta-basta pwede bumili ng coat and tie, mas maganda para maganda yung fitting, di ba? Papatahin mo pa. Ganun din sa Chinese herbal formulas. Sometimes you have special occasions na really requires special herbal combinations.
Itong lingwa xingwen na naaprubahan na nga sa FDA, ano ba ang kanyang
Naglalag
ginagamot?
talaga.
Oo. Ano ba ang ginagamot ng doc ng lingwa xingwen? Ano ang particular na ano niya, ina-address? Par
Lian Watching Man it was it was okay, sorry. I'm leaving some time because of the lag. Okay.
yes. Oo.
Lianhua Qingwen, the name literally, Lianhua is the two main ingredients. Qingwen means to clear heat or to remove yung init or remove yung pamamaga, inflammation. So, it does not treat COVID directly, meaning it's not designed to kill the coronavirus, but it can help mediate the reaction. So, meron kasing maraming sakit na, okay, let me rephrase. Lianhua was created in 2000 was created from two Chinese herbal formulas.
Okay.
One is for wheezing, cough, maplema or hirap huminga, parang hinihika na hindi.
Yes, yes.
The second one is to help clear the flu-like symptoms. Put them together, you have a combination of two formulas that clear viral infections na affecting the upper respiratory tract. So, ubo, sipon, parang hinihika, hirap huminga, pero hindi pa kailangan ng oxygen. Kasi pag kailangan ng oxygen, yan, sa hospital na yan, we might need stronger medicines. So, that's what I would say, give Lianhua for. Yung mga viral, kasi di ba may mga viral na ubo sipon, sasabihin ng doktor, di naman antibiotic ang bigay dyan, pahinga lang. At least now you have an option. You can give Lianhua.
Meron pa bang iba, doc, bukod sa
So,
lingwa?
yung konting sipon, that's the usual percent.
Oo.
There are many formulas. There's
Oo.
Yin Chao San, Sang Chi Yin, and then each one of those has modifications.
Ginagamit na rin sa
Chinese
atin.
medicine is all about, it's like memorizing recipes and
Oo.
technically, ang nangyayari, there are some practitioners who will give you a recipe, and then this is allowed by President Marcos nung araw for Chinese, local Chinese, kasi traditional.
Yes.
That's what I heard. I don't know the accuracy of the reports. So you can buy the herbs and boil it yourself. Or you can buy the commercially prepared ones. And the problem with the commercially prepared ones is, number one, technically, since they're already prepared, FDA will consider those as drugs and not food.
Mm-mm.
Yung hilaw na herbs, it's still considered food.
Mm-mm.
So, technically, hindi siya regulated. Technically,
Mm-mm.
bawal siya.
Mm-mm.
Yung lianhua lang ang approved.
Mm-mm.
The first one.
Oo. So ikaw, Doc, ano ang ginagawa mo ngayon kapag may lumalapit sa iyo na gusto nilang matulungan sila sa kanilang COVID? Ano ang mga ipinapayo mo bilang isang TCM practitioner dito sa Pilipinas?
Well, a lot of the questions to me is, can we use lianhua?
Mm-mm.
Now, assuming they can get it legally, that's not
Mm-mm.
up for me to decide. That's
Kasi
not up
wala,
for me
wala
to
pa sa market,
make
no?
judgment.
Mm-mm.
Wala pa, but the way I understand it, they'll be coming into the market soon. So I tell them,
Mm-mm.
in theory, if you have lianhua, your symptoms either match or don't match yung
Mm-mm.
indication.
Mm-mm. Okay.
That's what I tell them.
Okay.
I also tell patients that I wish that we had more of these over-the-counter Chinese herbs here because a lot of them are very useful.
Mm-mm.
Unfortunately, we don't. We don't live in Hong Kong. We're not in Taiwan. We're not in mainland China. So it's unfortunate that there's so many things that we can use to complement the Western medicine we already have. Kaya lang wala pang regulation, so hindi natin magamit.
How about acupuncture? Can it help people with COVID-19? What does acupuncture do?
In in
Mm-mm.
theory, yes, because what acupuncture does, it can do the same things herbs do. In fact, yun ang maganda sa acupuncture. Sometimes the patient, for some reason, hindi na dapat mag-oral medication. Siguro kidney failure. So even the herbs
Nakakatulong
will,
sa kanila, no?
maski not quote-unquote natural siya,
Mm-mm.
because it's medicinal, dagdag strain sa kidneys. Di ba? So the nice part about acupuncture is it can help with such problems, pero uh, I find mas mabagal siya kasi nasa loob na yung problema minsan pag COVID eh.
Okay. Oo.
Disclaimer, um, I've
Mm-mm.
treated some patients with hirap huminga, but
Mm-mm.
puro COVID negative. Hindi pa naman sila test positive for COVID.
Mm-mm.
So, saka naka-PPE ako, so I'm hopefully I'm safe.
Mm-mm.
But in Chinese medicine, it doesn't matter. Okay, so COVID yun, o SARS yan, o trangkaso, ganun, hirap huminga.
Mm-mm.
There are ways to do it. Lagyan mo ng konting karayom dito, boom, temporary relief. Mas nakakahinga na.
Mm-mm.
Still not addressing the root problem, but at
Oo.
least it helps.
Yun, nakaka-help lang na ma-relieve yung kanilang mga problema. Anyway, Dok, kung may mga tanong pa sila sa iyo o kaya gusto nilang magpatingin sa iyo, saan ka ba pwedeng pupuntahan, Dok, or kukonsultahin?
And they can search for,
Yeah?
right now, I'm still seeing patients in Oasis Acupuncture Clinic.
Mm-mm.
So marami kami doon na Western doctor na trained in acupuncture.
Mm-mm.
You can Google that. Or you can, siguro I haven't decided yet because
Mm-mm.
marami pa akong inasikaso.
Mm-mm.
Might be resuming clinic in PGH either
Oh.
second or third week of October. I'm
Mm-mm.
having a hard time fixing my schedule because, as I told you, I'm studying again.
Oo nga, oo.
Mm.
Anyway, Doc, thank you so
Nag-aaral,
much. Oo.
tumitingin ako ng pasyente,
Mm-mm.
nag-aaral ako, nagtuturo pa ako.
Oo nga, kaya busy-busy ka, Doc. Pero pwede ba sila magkonsulta online sa'yo? Meron ka bang page na pwede nilang puntahan ngayon? Yes,
I
Doc.
have a Facebook page, Philip Tangatwe, Acupuncturist, Manila, Philippines.
Mm-mm.
I also have a profile which I created. It's easy to chat me there,
Mm-mm.
where I also post my own thoughts about what's going on with Chinese medicine.
Mm-mm.
I
Philip
used to blog,
Tangatwe.
but I
Oo.
haven't had the time. Yun lang.
So that's it.
So,
Oo. Anyway,
Philip Nino Tangatwe kasi may
Philip
mga
Nino
kamag-anak
Tangatwe.
akong kapangalan.
Philip
I have a
Nino
second
Tangatwe. Oo.
I have a second cousin.
Mm-mm.
May Philip Tangatwe akong Yeah, kasi may Philip Tan Gatue ako na kamag-anak, eh. Baka siya yung i-message niyo. Ano, mas
Ay,
gwapo
hindi.
naman siya sa akin, so kitang-kita mo na hindi ako yun.
Hindi kayo masasagot ng kamag-anak kasi si Doc ang expert po dyan. Si Dr. Philip Tan Gatwe po ay isang Western and Eastern medicine practitioner. Doc, thank you so much again. Maraming salamat sa mga
But can I
ibinahagi
also
mo.
make singit
Yes. Yes,
one
Doc.
thing?
Oo, go ahead.
May sisingit din ako.
Go ahead, Doc.
May sisingit lang pala ako.
Mm-mm.
May ibang doktor na Philip Tan na nag-advise on bladder stone cleansing. Hindi po ako yun. Maraming biglang magme-message sa akin talking about gallbladder flush. That's
Oo.
Dr. Philip Tan.
Oo.
I'm Dr. Philip Tan Gatue.
Oo.
So, hindi po, mas gwapo din siya sa akin, so tell the difference. Okay. Hindi ako yung nag-gallbladder flush.
Anyway,
Ibang Philip Tan yung nag-gallbladder flush. Ako yung nag-acupuncture and nag-herbs.
acupuncture. Ayan.
Okay?
Doc, thank you so much again. And ingat ka palagi, Doc, ha?
Ganun pa.
Maraming salamat. Dr.
Hindi pala
Philip
naka-angle yung camera ko
Tan
ng tama.
Gatwe.
Okay.
Ayan, ayan.
Okay,
Lalo ka
salamat
nang
po.
gumapo. Thank you so much, Doc, ha? Maraming salamat.